You're watching TVC Breakfast. Let's get into our next discussion now. Of every 100,000 births in Nigeria, an estimated 545 women die during the process of giving birth. And this is one of the highest maternal mortality rates in the world. Now, this is due to a lack of proper health care during the period of pregnancy, as many Nigerian women, especially those in the rural communities, cannot access primary health care. And the female folk for years have also been subjected to harsh and unhealthy practices like female genital mutilation. Now, though there are ongoing efforts to stop this practice that is deeply rooted in superstition and tradition, some women in the rural areas are still forced with it. So to make sense of this now, joining me is the Executive Director, Hasty Health Initiative, Rhoda Robinson, to help me make sense of this. And also joining me on the conversation is the Reproductive Health Officer of Oyo State Primary Health Care Board, Bilkisi Oluwakemi and Olawoyin. All right, thank you very much for joining us. But let me start with you, Rhoda. Nice to see you.
Nice to see you too.
Now, when it comes to the issue of female genital mutilation, we often talk about this year in, year out. But how much of awareness is there right now from the past years of, putting it on the front burner from your assessment?
Thank you, Mike. First, as you know, female genital mutilation is the cutting or total or partial removal of any part of the female genitalia. That's her private part for non-medical reason. It's a violation of rights and it's a crime in many countries, including Nigeria. And then you'll find that while a lot of people in local communities know about female genital mutilation, they do not have a clear understanding of the serious consequences that are involved with female genital mutilation. Last year, Hasty conducted a research on the understanding of female genital mutilation among community members in 3 states. That's the 3 southwestern states with the highest prevalence of FGM in Nigeria. That's Osun, Oyo, and Ekiti State. And one of the things that we realize is that while a lot of women, a lot of families know about female genital mutilation, they have a poor understanding of what it does, and they have a belief on the unfounded benefits of female genital mutilation, which contributes to its continued practice and its continued occurrence in these local communities.
All right, Bilkis, let me come to you on this. The point there is, when we talk about female genital mutilation, this awareness, like Rhoda has said, there are efforts here and there, but people still hold on to some of this superstition, some of this beliefs that it is necessary to be done. But make us understand, if there is, because we know that there is no benefits, whether it's health or social or emotional, there are no benefits to FGM. But talk to us about, from that window of awareness, what do we need to know about FGM and how to stop it and how to ensure that it doesn't continue?
Thank you very much, the uncle. Just like my colleague Rhoda has said, female genital mutilation awareness has been on for some years. And we must first note that female genital mutilation is an age-long cultural practice. And because so many people believe that the practice is socially connected and the bond of culture with the practice is so high. So despite high level of awareness embarked upon by government at all levels and other partners, some of our people still believe that the culture should continue. Anytime we have opportunities to go to the field, what we usually make them realize is that we need to delink the culture from the practice, because of the negative health impacts on women. The health consequences of female genital mutilation outweighs whatever belief or reason why people do mutilate their girls and women. And female genital mutilation contributes to high prevalence of maternal deaths, which we usually make the public and the community people to be aware of. But it is a bit difficult for us or for the victims or the survivors to kind of associate the health consequences of female genital mutilation to the practice, because oftentimes female genital mutilation is carried out, especially in the Southwest, when the girls are still young, very, very young, baby, between the age of 40 days and 1 year. So for us to now let them know that what these women are facing as their reproductive age is associated with the practice that have been performed years back, I think we have a challenge there. But we keep on trying to analyze to the community people that FGM does not have any health or social benefits. Rather, it's kind of predispose women to several risks during childbirth and immediately afterwards.
Okay, I'll come to you shortly on the issue of what efforts that you are doing. When I mean you, your agency and your organization in your state, what you're doing to help create awareness or prevent the continuation or perpetration of FGM. Now, Rhoda, she talked about the issue of the challenges.
Yeah.
Make us understand, what are some of these challenges that stand as obstacle to ending FGM? As much as now we know there are no health benefits, there are no emotional benefits, there are no benefits whatsoever. So what are the obstacles? Why can't we just throw it to the garbage of history?
I wish it was as easy as just throwing away rotten food and then disposing it and the trucks carry
and it goes.
But because FGM is so entrenched in our culture and cultural belief and as an identity as a people, it makes it difficult to convince people that what you're doing is no longer relevant in this age. There have been, from talking to different survivors and people who practice FGM, different reasons ranging from psychosexual reasons of practicing FGM, making sure that the girls stay virgins till they're married, making sure that she has easy childbirth, and these are contradictions to reality. Women who have gone through FGM are 3 times more likely to experience complications during childbirth, and they are also twice as likely to experience obstetrics distress or infant distress when they're giving birth. So FGM has nothing to do with virginity, has nothing to do with morality, has nothing to do with a woman being able to stay in a marriage. Rather, a lot of challenges have come when women are not able to fully express themselves in their marriages. So you see that most of the beliefs that promotes FGM are actually contrary to what FGM actually does. Now, getting people to believe that, as Ms. Bilkeso had earlier said, is that majority of the challenges or the consequences that come from FGM, you don't see them immediately. You have the short-term challenges such as infection, bleeding, shock, or intense pain. But when you talk about the long-term consequences of FGM, a lot of them forget or do not ascribe those consequences or those challenges that you're facing to the practice of FGM. You have people who have reproductive tract infection. You have people who have complications during childbirth.
So at the time the lady who has gone through FGM later in life is going through these, they would have forgotten, that this is a consequence of something that happened 10, 15 years, 20 years ago.
And then nobody says anything about it. And because it's so rampant, they don't see it as something different. Somebody went through it, you are going to go through it. It's a normal part of life. It has nothing to do with the practice, which is false, because different studies have shown that these things are directly related. And having people to understand this and say that, okay, this practice no longer needs to continue, that we can use other methods to ensure that our girls are safe, it's very, very important.
All right, let's get to Bilikis there. Now, Bilikis, talk to us regarding the efforts to throw FGM to the garbage of history, because this is what, putting it very bare, I think this is what we need to do. But you talked about the issue of the challenges, and Rhoda just mentioned the challenges of doing that. But talk to us, what is the effort? What's going on? Because Oyo State is one of the states that has the prevalence of FGM in the southwest of Nigeria.
Thank you very much. Several efforts has been on.
It seems we're losing your audio. Okay, we'll come back to you when, yeah, I think it has to do with the network. We'll have Bilikis when the audio gets better. But Rhoda, let me come back to you on this now. Talk to us about stigma.
Okay.
How does stigma come in there? Because we're talking about this sometime, and someone mentioned that there's also stigmatization in the issue of FGM.
Yes, now because FGM is culturally accepted or it's a cultural practice, by default, you are expected by your society, by your community, to toe the line. And when you do not, you stand the risk of being ostracized from society. And it's not just by the community, even family members who believe in this practice, and you are kicking up against it.
So they see you as the abnormal person.
Yes, as a black sheep of the family. And we've had cases where it has become violent for those families who do not want to continue FGM. And then there have been threats of the daughters not being able to get married, because it is also linked to a lady's eligibility to find a spouse when she's old enough. And so if you are not caught when you want to get married, it's saying that it's more difficult for you to get a husband, and no one wants to marry you because you are promiscuous or this, or you are unclean, and different unfounded terrible myths that kind of perpetuate the continuation of those practices. And one of the key things that we need to start doing is to ensure that people understand the difference between facts and myths, and they understand the fact that FGM cannot get what they are already saying would happen.
Exactly.
FGM has no relation if a woman can have children or cannot. Rather, the possibility of there's a higher increase of having challenges of giving birth when a woman has gone through FGM. And getting them to understand this is one of the major things that we need to start doing to ensure that they drop the practice.
All right. Okay, Bilikis, I understand you're back on now. I was asking you earlier on the efforts that you are putting in, your agency, the government, in trying to throw FGM in the garbage of history.
Yeah, so sorry, the network...
no, it's fine, we understand.
...was a bit erratic, yeah. The Primary Health Care Board, under the coordination of Oyo State government, has been collaborating with different partners to ensure that FGM become a thing of past in Oyo State. And one of the key things that we have been doing for years is awareness creation. Awareness creation at all levels, state, local governments, and even the community level. And since we are talking about an issue that concerns the culture, we cannot but also engage the custodians of culture. And when we are talking of custodian of culture, we have been engaging with traditional leaders, religious leaders, and other community gatekeepers in the End FGM program. And the awareness creation does not stop only at the community level. We also engage with different healthcare providers, because it is not only traditional circumcisers that do perform female genital mutilation, though the highest, FGM is performed by the traditional circumcisers. We still have about 18% of this practice, according to study, being performed by health workers. So we engage with different associations of healthcare providers, National Medical Association, Nursing and Midwifery Council. We also engage with community health extension workers, etc. And awareness creation also goes on here, radio jingles, and even television awareness. We also make sure that we train health workers, because after educating the community about the health consequences, we realize that some of the survivors realize that the health challenges they are having presently are associated with the practice. So we train our health workers to make sure that survivors can, access management and health services in our primary health care centers across the state. Our government has also made laws, apart from the national law, to kind of make sure that our people comply to stoppage of FGM. And we have state law, we have national law. And to make these laws effective and functional, security agents were also trained to enforce the law. All these, are ongoing. And we hope that before the target, that is 2030, where all the countries that are practicing FGM hope to end female genital mutilation, or your states will set the pace for other states to follow.
All right. We look forward to that positivity, and whatever that has to be done to kick FGM far away is what we will do. Bilikis Olawoyin, the Reproductive Health Officer or your State Primary Healthcare Board, thank you very much for talking to us.
Thank you very much for having me.
Great. All right, I still have Rhoda here. She talked about the issue of law.
Yes.
Let's talk about the issue of prosecution. I don't think I've read in any paper recently that somebody was sentenced to months or weeks or some fines
or some nothing.
Or what is it called for involvement in FGM?
Unfortunately, we do have laws. We have the VAP Act that speaks about FGM and criminalizes FGM. The different states we're working in have laws that speak and criminalize FGM. However, we have till date not one prosecution on FGM.
Wow.
And one of the main reasons is that people do not report FGM.
Okay.
And if you do not report FGM, if there are no witnesses, we cannot prosecute. It's as simple as that. And it is also as difficult as that, because we need to start getting people to understand that FGM is a criminal offense, and you cannot...
Please underline that. FGM is a criminal offense in Nigeria.
In Nigeria, in the different states, in Oyo State, in Osun State, in Ekiti State. FGM is a criminal offense. And people need to understand that when they practice FGM, either as cutters, as the parents taking their child for FGM, as a family suggesting that a parent takes their child for FGM, they are contradicting the law. And that we need to start encouraging people to report. One of the activities of HACE is to strengthen community's response in this area by training focal persons that reside in the community and provide this avenue for women and girls and men to report FGM cases. As you said, there are challenges to reporting because of discrimination, ostracization in the community, and possible backlash for doing that. And systems are in place working with the different state governments, the different legal partners, enforcers, and community civil society organizations to ensure that that response system is there. So when an individual reports a case of FGM or sees that a family wants to take their daughter for FGM and reports that, the structures and the system is in place for those community focal persons to take that person to safety and ensure that they get support.
All right. I wish we had time to talk about this because there's so many areas of FGM that we like to, or we would have looked at, especially talking about the issue of rural-urban migration, how that is turning things around. But we certainly will come back again to discuss this.
I hope so.
Thank you very much, Rhoda Robinson.
Thank
you for what you do and in creating awareness in this regard.
Thank you so much. Thank you.
Right.